I'm Deirdre Bruno, and I'm a nursing student at Aspen University. I am presenting today on communication for my Module 6 Foundations class. I have a volunteer today, Dr. Brown, which is really Yakima. She was kind enough to volunteer for me. So for this scenario, I will be presenting a case study from a hospital, and then afterwards I'll be telling you what the pertinent data is out of that scenario. I'll follow up by presenting an SBAR to Dr. Brown and then review the case afterwards with you. Thank you for allowing me to present this case study on Mr. O. Mr. O is a 63-year-old man. He was dizzy and lightheaded at home and almost fell. His wife brought him to the ER by car. He was admitted to AMU with syncope. This is not the first time being admitted to a hospital. He has been treated in the past for congestive heart failure and acute myocardial infarction. He feels like he is pretty healthy as he only takes NSAIDs at home for his chronic back pain. Mr. O got to AMU at 1600. His nurse is Jenny. Jenny RN assessed him and found his blood pressure to be 138/84. Pulse was 76 and regular. His respiration rate is 16. He is afebrile at 98.6. Mr. O's labs are normal, but his IV infiltrated during transport. Nurse Jenny started a new IV and put a warm compress on the old site. Nurse Jenny reported off to Nurse Ben at 1900. At 21:30, the PCA found Nurse Ben and told him that he had just helped Mr. O off the bedpan. Mr. O had a large black tarry stool and was complaining of not feeling well. Nurse Ben went to assess Mr. O. His vital signs were blood pressure 94/66, pulse 114, and respiratory rate was 24. His pulse ox was 97%, and his skin was pale and clammy. Nurse Ben asked him how he was feeling. Mr. O said he just didn't feel well and could not get comfortable. He asked if he could do something for his belly. It is really hurting. Nurse Ben assessed his abdomen and found that it was distended, and Mr. O had diffuse abdominal pain. He rated his pain a 6 on a scale of 10. So, the most pertinent information out of the scenario would be the fact that he is dizzy and lightheaded. He almost fell at home. He has syncope, and he has a history of congestive heart failure and acute myocardial infarction. He also takes NSAIDs at home for his chronic back pain. Upon admission, the vital signs were all within normal limits at 138/84, pulse of 76 and regular, and his respiratory rate of 16. He is also afebrile at 98.6. So all of his labs were normal, and at 21:30, he had the large black tarry stool. He's complaining of not feeling well, and when Nurse Ben went to assess him, the vital signs had changed. They had declined down to 94/66 for the blood pressure. The pulse went up to 114. The respiratory rate went up to 24. And his pulse ox was 97, which is normal. His skin was pale and clammy. And upon assessment, Nurse Ben found that he had pain on a scale out of 1 through 10. His abdomen was distended and the pain was diffuse. So next I'm going to do a mini simulation with my Dr. Brown volunteer. Thank you so much. So I will be doing an S-bar on Mr. O. Mr. O, Dr. Brown, I have a patient, Mr. O, a 63-year-old male. He is complaining of abdominal pain, 6 out of 10. He had a large black tarry stool at 2130, and now he's asking for something for his stomach. His was admitted at 1600 with syncope. He has a previous medical history of congestive heart failure and myocardial infarction. He does take NSAIDs at home for chronic back pain. When I went in to assess him, his abdomen was distended and he is complaining of the abdominal pain. The abdominal pain is diffuse. His most recent vital signs have changed. His blood pressure is 94/66. His pulse rate is 114. His respiratory rate is 24, and his oxygen level is at 97%. The patient appears unstable. His skin is pale and clammy. At this time, my initial recommendation is a repeat of his labs. I believe we should get a CBC, a complete blood count, chem panel 7, a cross and type, and an abdominal ultrasound. Also, you may consider giving him pain medication for his stomach pain and possibly increasing the IV fluid rate. Thank you.
Thank you.
So, my thoughts on the scenario is that with the change in the vital signs, I can see that he's become unstable. There was a drop on his blood pressure from 138/84 on admission down to 94/66. And his pulse rate jumped from 76 up to 114. Also, his respiratory rate was 16 when he came in, and now it's up to a 24. So that shows me that he's in some kind of distress, and the fact that he is pale and clammy shows me that he's in immediate risk for a poor outcome, that he needs to be tested farther, and that the doctor may need to come in and reassess him and make some changes. The other thing that I feel about this is the black tarry stool and the distended abdomen with diffuse abdominal pain. The black tarry stool shows me that there's some kind of possible internal bleeding, and that is a warning sign right there. The fact that it's distended could be filling up with some kind of blood, and that's why I'm recommending the ultrasound. I'm recommending the CBC to check for the H&H. We may also want to get platelets, and then the cross and type is in case he needs some kind of transfusion. The recommendation for the pain medicine is just to make the patient more comfortable and more relaxed, so maybe that'll slow down his heart rate and may slow down his respiratory rate as well, and slow down the circulation of the blood if he does have an internal bleed. And then I did recommend increasing IV fluids, and that's just to bring up the blood pressure because it is starting to get a little bit low. Overall, that is my recommendations. Thank you for allowing me to present this case to you, and thank you to my volunteer, Dr. Brown. Thank you. Have a good night.